Addiction to crack cocaine, depression, homelessness. Just one of these could push someone over the edge. But what does it take to survive all three? Let's talk about it.
Welcome to My Healthy Mind, a show about real people triumphing over problems and helping others heal. I'm your host, Michael Hunter, and this is my co-host, Elizabeth Atkins.
Hello.
And we're going to talk about problems that are hard-hitting, that normally are considered taboo. People don't want to talk about them, like depression, human trafficking, drug addictions, schizophrenia, any type of chronic health care or social problems that we normally don't get a chance to talk about in our day-to-day lives. We're going to talk about them on My Healthy Mind.
Yes, this is a safe forum for people to come together and learn how to heal, and most importantly, to shatter the silence that makes people suffer in shame and embarrassment and fear to seek help for problems that traditionally have been too frightening to seek help for. So we're welcoming people to open an honest, powerful conversation about healing.
Absolutely, and I love that, Elizabeth, that it's open and honest,
Yes.
and there's no holds barred,
Right.
and people don't have to go into a shell and say, I don't want to talk about this, I
Right.
don't want my family to know.
Right.
This is very important for everyone to
Yes,
know.
absolutely. And denying a problem only makes it worse, as
Absolutely.
you will see with many of our guests who will tell us that. Denying a problem makes it explode into a crisis or worse.
Yes, and today we have two very special guests, and we're going to talk about holistic healing and different approaches to substance abuse and other addictions. So we should have a really good show today, and we'll talk more with our guest after this commercial break.
Burns, so scared of his return that I can't sleep tonight in this hospital life.
We have 3 beautiful children, and everything you do or say to me, they take pictures with their minds, and I want to put a stop to that.
Sometimes I have thoughts of killing you. You know that?
Go ahead. You're doing me a favor.
Alex was the only one that knew the secrets.
Boy, why don't you leave that girl alone for you mess around and get her pregnant?
Why do you have so many boyfriends?
They all treat me nice.
When they ever treated you to anything? Only time they come around here is when they want one thing.
No! No!
You eat so damn much, why can't you choke on something? You're just a fat, disgusting excuse for a kid, and I ought to smack you!
I should have died instead. They were right.
No, you have. Life is worth living.
I have every type of abuse in there.
Yeah. Verbal, physical, sexual, mental.
You name it, it's in that room.
You see, after years of abuse, you lose yourself.
Miss Vivica. Miss Vivica.
Cause this time, it's the last time. I know that my eyes have seen too much. This nightmare is not fair, and I've had enough. You break me. Did you say you're sorry? You call this love, but this time your lies are not enough. This time.
I know you've been through some hell and high water, but I see a turnaround right now. You will be silent no more.
Stress, depression, and severe mental illness can happen to anyone. Team Mental Health Services has been helping those struggling with these conditions in southeastern Michigan. Within 24 hours of reaching out to our team, members receive psychiatric evaluations and begin the necessary treatment for recovery. Team Mental Health Services prides itself on going the extra mile for its members.
And it was towards the 6th court date. I finally stood up and said, I can handle this process the rest of the way. And it was all because of the motivation and encouragement I got from Team Mental Health staff.
Team Mental Health Services, because we care and you can.
Gonna have a funky good time. Gonna have a funky good time. I'm gonna have a funky good time. I'm gonna have a funky good time. Gonna take it high. Yeah, yeah, yeah. Take it high. Yeah. Woo! 1, 2, 3.
Woo! Yeah, that was awesome. Phenomenal. We are so happy that you're here, Michael.
Yes.
Yes.
Glad to be here.
Michael Brock extraordinaire.
Yes.
Thank you for being our guest today on My Healthy Mind.
Not a problem.
We are a show, as you know, that talks about things that people typically don't talk about, Michael.
Okay.
And so you were gracious enough to come today and tell us a little bit about your story and where you've come from and some of the things you're doing now. And I think that that will really help some other people heal.
Well, I am a recovering addict, an alcoholic. I have 26 years clean and sober.
Wow.
Only through the grace of God.
Phenomenal.
And I attend meetings on a regular basis. I have a sponsor, and I read the literature, and I also work in the mental health field.
Oh, excellent. We want to hear about how low did you go. We want to hear the worst moments and how you ultimately rose up. So where were you? What happened?
Very, very difficult time of my life was in 1988. Right before I went to the Salvation Army of Harbor Light for help, I was homeless. And from crack cocaine, alcohol, marijuana, pills. I had a full ride scholarship to Western Michigan University back in 1984. And I went from Park Place to Park Bench.
Ooh.
Wow.
Whoa.
Park Place to Park Bench.
Wow.
Okay.
And how did you feel?
I felt terrible, depressed, anxious, full of anxiety, sad, unhappy, very, very unhappy, and insecure with a lot of fear.
So what do you think put you in that position? How did you get there?
Well, my family was dysfunctional. My sister, unfortunately, she had a very, very rough time with drugs and alcohol, as well as my older brother. And my mom died when I was 11 years old.
Oh, I'm sorry.
And when you were going through the plight that was taking you eventually spiraling down, did you have any outlets to talk about it? One of the things we like about our show is that it's an avenue and a forum for people to talk about it openly.
Okay. Well, at that time, I had them, but I didn't choose to use and utilize them. I mourned the death of my mom by using drugs and alcohol and the life of crime.
We want to hear all about that, and especially how you rose up and out after this commercial break, Michael.
Thank you very much.
You're welcome.
Stress, depression, and severe mental illness can happen to anyone. Team Mental Health Services has been helping those struggling with these conditions in southeastern Michigan. Within 24 hours of reaching out to our team, members receive psychiatric evaluations and begin the necessary treatment for recovery. Team Mental Health Services prides itself on going the extra mile for its members.
And it was towards the 6th court date. I finally stood up and said, I can handle this process the rest of the way. And it was all because of the motivation and encouragement I got from Team Mental Health staff.
Team Mental Health Services, because we care and you can.
Do people here actually care about you and your future and what you become after you graduate high school?
Loyola's mission is to turn out good young men. Loyola is a place to help us grow.
a smaller setting and more one-on-one.
Give you that one-on-one attention that you don't normally get.
Making sure that the student is taken care of spiritually, educationally, and physically.
I focus more at this school than I did all my other schools.
By the time they get to about the 10th or 11th grade, they're basically bonded like brothers.
If you're looking for a brotherly love or someone to lean on or get in touch with and talk to personally, this school is the perfect place to go.
Welcome back to My Healthy Mind. We are talking with musician extraordinaire Michael Brock, who's sharing with us a powerful story of recovery from addiction. So Michael, can you pick up where we left off, please, and tell us how low did you go and how did you rise up and out of that moment of homelessness and addiction?
Sure, Elizabeth. I was on the east side of Detroit back in 1988, smoking crack cocaine, drinking alcohol, hanging out all night, and I became homeless. From there, I went to the Salvation Army of Harbor Light in September. Matter of fact, it was September 14th, which is my clean date.
Oh, congratulations.
And like I said before, the 26 years clean and sober, I'm very, very, very happy for that.
Excellent. Congratulations.
How long were you at Harbor Light?
7 months, 4 days, 3 hours, and 28 seconds. To be
Oh
exact.
my gosh, wow. So what's fascinating is that you had a full ride scholarship to college and you ended up in a recovery program instead.
Yes, I came to Detroit for an audition with music, and actually it was drug related, to be honest with you. I knew that I could get drugs and a lot of alcohol, and I was underage, and being in a drug infested neighborhood, and from there I just became homeless.
Oh my goodness. And you were also dealing with depression because your mother died?
Yes, my mom died when I was 11 years old, and that's the way I dealt with her dying.
Right, drugs and alcohol.
I went straight to drugs and alcohol.
And Michael, during the commercial, you mentioned that you had siblings that struggled as well. And I'm wondering, as you were processing and eventually able to come out of it, did you have any outlets to talk about it? Like, this show is a forum for talking about it to help people have an outlet. Did you have any such outlets?
Thank you, Michael. Yes, I did, but I didn't use them. I went straight for the bottle and marijuana and crack cocaine, along with regular cocaine. And I just drowned myself in drugs and alcohol. And after becoming homeless, and I didn't deal with any of the professors or any other relatives or anything like that. I had friends, but I didn't use them.
So when you hit rock bottom, what was it within you that decided to seek help?
Well, actually, I stole some drugs from one of the drug dealers in Detroit, and I got beat up pretty bad, and from some young guys. And I saw Harbor Light, and I went in there actually for protection.
Oh my goodness!
But that beating was motivating in recovery for me. Yes.
And so then what empowered you through the recovery process to stick with it?
Well, they gave me an outlet with being honest, open and honest and willing.
Yes.
After that, it was the feeling of doing things on a realistic basis without drugs and alcohol, and how rewarding it became. And sustaining my sobriety was also very rewarding. And the feeling was mutual. It was like I had drugs, but I didn't. I had a spiritual awakening.
Beautiful. Excellent. Awesome. And so with that awakening, you've performed with the Four Tops and the Dramatics and the Michael Brock Band. Now you're helping people as a therapist at Team Wellness Center. And we are so happy that you joined us.
Yes. Combining music and therapy is one thing that I really, really appreciate, being with Reverend Fowler over at Cass Community Methodist Church as well.
Michael, will you please play another song for us?
Looking forward to it.
Thank you. All right.
Watching over you, watching over you, watching over you. Oh,
so scared of his return that I can't sleep tonight in this hospital life.
We have 3 beautiful children, and everything you do or say to me, they take pictures with their minds, and I want to put a stop to that.
Sometimes I have thoughts of killing you. You know that?
Go ahead. You're doing me a favor.
Alex was the only one that knew the secrets.
Boy, why don't you leave that girl alone for you mess around and get her pregnant?
Why do you have so many boyfriends?
They all treat me nice.
When they ever treated you to anything? Only time they come around here is when they want one thing.
No! No!
You eat so damn much, why can't you choke on something? You're just a fat, disgusting excuse for a kid, and I ought to smack you!
I should have died instead. They were right.
No, you have. Life is worth living.
I have every type of abuse in there.
Yeah. Verbal, physical, sexual, mental.
You name it, it's in that room.
You see, after years of abuse, you lose yourself.
Miss Vivica. Miss Vivica.
Keep me here, 'cause this time is the last time. I know that my eyes have seen too much. This nightmare is not fair, and I've had enough. You break me. Did you say you're sorry? You call this love, but this time your lies are not enough. This time.
I know you've been through some hell and high water, but I see a turnaround right now. You will be silent no more.
Stress, depression, and severe mental illness can happen to anyone. Team Mental Health Services has been helping those struggling with these conditions in southeastern Michigan. Within 24 hours of reaching out to our team, members receive psychiatric evaluations and begin the necessary treatment for recovery. Team Mental Health Services prides itself on going the extra mile for its members.
And it was towards the 6th court date. I finally stood up and said, I can handle this process the rest of the way. And it was all because of the motivation and encouragement I got from Team Mental Health staff.
Team Mental Health Services, because we care and you can.
Welcome back to My Healthy Mind. I'm Elizabeth Atkins, and this is my co-host, Michael Hunter. We are so excited to talk with a wonderful woman today who's going to share some information that can help you improve your life and heal and feel better. Her name is Sara Shields, and she's a registered nurse, and she's executive director of Team Wellness Centers Clinic in Southgate. She specializes in holistic healing, especially for addiction recovery and mental illness. It's so powerful. Welcome, Sara.
Hi.
Welcome.
Hi. We're so happy to have you here. Now, a lot of people hear the term holistic healing, but what does it really mean?
When we talk about holistic, we're really talking about balance between body, mind, emotions, spirituality, relationships. The term holistic health can sometimes be a little bit scary to people because I think they go right towards this place of thinking about herbs and crystals and yoga. But it really is just about, you know, mind, body, spirit, emotions.
Yes. So what are some things that you do teach people? Because you're in a clinical setting, so you're integrating holistic healing in a clinical setting with medication, with therapy. How does that work?
Well, sometimes you can be a lot more effective with the medicine if you start to learn coping and start to learn how to take care of your body, start to learn how to heal your relationships. Sometimes people will come in and they'll be so focused on, I can't feel anxious, I need medicine. But then they're setting themselves up to always need medicine, which can put people in some trouble too. So The idea is to start teaching people about their bodies and about how their body's connected to their mind, and about how exercise and movement can do things like relieve some of the anxiety, can help with the depression.
So with holistic approaches, it's a complement to the medication and not necessarily either or.
Right. Sometimes the holistic modalities can be effective all by themselves. It would just depend on the intensity of the mental illness, what coping skills people already have.
And what about, because you're an RN, right?
Right.
What about as it relates to other physical health issues and not just mental health? Is there benefit in that sense as well?
Yes. Well, we know that blood pressure can sometimes go up when people are stressed out. It can go up when people aren't taking care of their bodies. So the idea would be to not just focus on take a blood pressure medicine and get some exercise, but also how do you cope with stress? How are your relationships? Are you living in a chaotic and disorganized environment? And maybe you should clean up your closet and change your diet. And
Well, as somebody who meditates daily and practices yoga and a holistic lifestyle, I know that number one, it relaxes you. So if you're dealing with the issues of mental illness and addiction, it would just be tremendously powerful to integrate some of these practices that you're sharing. How can you tell people are really being improved by what you're teaching?
Well, stress is the root cause of so many illnesses, so many mental illnesses, addiction, pain. So when they start to feel empowered to take care of themselves and they start to understand how to relax, when the pain starts going away, then I know that they're getting something out of what I'm trying to teach them.
Perfect. Those are such powerful points. Thank you so much for joining us today, Sara.
Thank you.
You're welcome.
Stress, depression, and severe mental illness can happen to anyone. Team Mental Health Services has been helping those struggling with these conditions in southeastern Michigan. Within 24 hours of reaching out to our team, members receive psychiatric evaluations and begin the necessary treatment for recovery. Team Mental Health Services prides itself on going the extra mile for its members.
And it was towards the 6th court date. I finally stood up and said, I can handle this process the rest of the way. And it was all because of the motivation and encouragement I got from Team Mental Health staff.
Team Mental Health Services, because we care and you can.
The people here actually care about you and your future and what you become after you graduate high school.
Loyola's mission is to turn out good young men.
Loyola is a place to help us grow.
A smaller setting and more one-on-one.
Give you that one-on-one attention that you don't normally get.
Making sure that the student is taken care of spiritually, educationally, and physically.
I focus more at this school than I did all my other schools.
By the time they get to about the 10th or 11th grade, they're basically bonded like brothers.
If you're looking for a brotherly love or someone to lean on or get in touch with and talk to personally, this school is the perfect place to go.
Welcome back to My Healthy Mind. This is the segment of our show where we hear from our viewers. So let's talk about it. Elizabeth, our first question is on our Facebook page, and it asks, I think I'm addicted to junk food, and I think it's affecting my mental health. What can I do?
Ooh, great question. Food addiction is a very serious and real problem, and there are 12-step programs available that can help you, such as Overeaters Anonymous and Food Addicts Anonymous. So I highly recommend that you visit their websites, find a meeting near you, and go and see how that can help. If not, if you want to get more help, I would seek therapy to talk about why you might be addicted to these food substances, such as sugar and fat. Nutrition plays a tremendously powerful role in our mental health. A healthy body with nutritious food creates a healthier mind. So please, I'm so glad you asked for help. Michael, I have a question from our Twitter page. John wants to know how he can stop drinking so much to the effect that it's impairing his ability to function in daily life.
Wow, that is a great question as well. What I would suggest you do, John, is just take a moment and reflect. A healthy body, as Elizabeth just said, starts with a healthy mind. You have to make up your mind that you want to do life differently. As soon as you make up your mind that you want to do it differently, reach out to some help programs like 12-Step or Teen Wellness Center, and you'll be on your way to recovery. I have a question that came in from Twitter.
Yes.
It says, I'm afraid I'm passing bad habits like cigarette smoking on to my children. How can I get help and set a better example?
I love that question. There are a tremendous number of resources available at your local community mental health website. You can find where you can get therapy or go to parenting groups to learn tips on how to set a better example for your children. Michael, I have a question that came in on our website, myhealthymind.com. Someone wants to know how they can improve their health because they're taking drugs, illegal street drugs, and they're worried about the long-lasting health impact. What can they do?
The first thing you want to do is understand that when you're taking a lot of medications, whether it's legal or not, or drugs that are illegal, it can have a lasting effect on your body, your kidneys, your liver, your heart, your circulation system. So you want to make sure that you are not putting your life in jeopardy for that temporary high or thrill.
Thank you, Michael. We want to hear from you. My Healthy Mind is your safe place where you can ask any question about a health issue that's been taboo or that you've been afraid to talk about. So please hit us up on Facebook, Twitter, or email us at myhealthymind.com. We want to hear from you, and no question is off limits. So we look forward to helping you hear stories of inspiration that enable you to live your best life in mind, body, and spirit. We will see you next week on My Healthy Mind.